Yes, yesterday we presented the OSPREY study, which is a multi-center prospective study looking at the accuracy of PSMA PET-CT imaging using the fluorinated PYL tracer. So basically, this is the first study that was conducted with blinded readers, prospectively multi-center, with truth standard being the pathology. So basically, we conducted that study where patients were imaged at staging, and we report the accuracy compared to the lymph node dissection histopathology. And basically what we found is that the sensitivity was not as high as reported in retrospective non-blinded study in the literature, but the specificity was very good. It was close to 100%, being 98 to 99% based on which reader was reading. So that's very exciting, and the negative and predictive value are very high too. So I think this is really a new tool that will help the clinicians to make the best decisions for the patient once they're diagnosed with prostate cancer. So there were 10 centers throughout Canada and the US, and more than 300 patients were accrued in that study. And we compared, in fact, the sensitivity and specificity of the tracer to find a lymph node metastasis. And what we found, in fact, is that the tracer is not as sensitive as it was shown in retrospective studies. So when you conduct a study and blinded with the readers and all that, you don't find the same sensitivity that is reported. And but we found that the specificity, so when it's positive, you're sure that it's a real cancer. So that's the most important point of this study. Another very important finding in this study is that we found in about a fourth of patient metastasis at staging in these patients. So you have this patient that has negative conventional imaging with PET scan, with a CT scan and with a bone scan, and then you do this new molecular imaging technique, and then you find in 1/4 metastasis that might change completely your management. So I think that was one of the most important findings there. So for now, these tracers are not approved by the FDA and Health Canada, but I think that these molecules will be, and new imaging technology will be in the clinic pretty soon, and I think that there is really an added value to use them at staging when you first diagnose the prostate cancer, to be sure that you don't do a local treatment for nothing. And I think that also it should be used also at restaging if you have, let's say, a surgery and then the prostate cancer recurs, to find where is the disease before deciding which treatment to do as a salvage treatment. Absolutely. Doing a worthless intervention costs a lot of money and also can harm the patient. So I think that by having more information to decide which treatment to go further after you see the patient or after it recurs will save money and will save also side effects to the patients.